Polycystic ovary syndrome, PCOS. Polycystic ovary syndrome is a common endocrine system disorder among women of reproductive age. Women with PCOS may have enlarged ovaries that contain small collections of fluid called follicles located in each ovary as seen during an ultrasound exam. It can cause infertility issues. Signs and symptoms often begin soon after a woman's first period. In some cases, PCOS develops later during reproductive years, for instance, in response to substantial weight gain. Irregular periods are the most common characteristic. Examples include menstrual intervals longer than 35 days, fewer than 8 menstrual cycles a year, failure to menstruate for 4 months or longer, and prolonged periods that may be scant or heavy. Elevated levels of male hormones may result in physical signs such as excess facial hair and body hair, adult acne or severe adolescent acne, and male pattern baldness. Polycystic ovaries become enlarged and contain numerous small fluid-filled sacs called cysts which surround the eggs. Doctors don't know what causes PCOS, but these factors may play a role. Insulin is the hormone produced in the pancreas that allows cells to use sugar, your body's primary energy supply. If you have insulin resistance, your ability to use insulin effectively is impaired, and your pancreas has to secrete more insulin to make glucose available to cells. Excess insulin might also affect the ovaries by increasing androgen production, which may interfere with the ovary's ability to ovulate. Your body's white blood cells produce substances to fight infection in a response called inflammation. Research has shown that women with PCOS have low-grade inflammation, and that this type of low-grade inflammation stimulates polycystic ovaries to produce androgens. If your mother or sister has PCOS, you might have a greater chance of having it too. Researchers also are looking into the possibility that certain genes are linked to PCOS. Treatment can reduce unpleasant symptoms and help prevent long-term health problems. Most women who have PCOS can benefit from losing weight. Even 10 pounds may help get your hormones in balance and regulate your menstrual cycle. Walking is a great exercise for this. Eat heart-healthy foods. This includes lots of vegetables, fruits, nuts, beans, and whole grains. It limits foods that are high in saturated fat, such as meats, cheese, and fried foods. Women who smoke have higher androgen levels that may contribute to PCOS symptoms. Your doctor also may prescribe birth control pills to reduce symptoms, metformin to help you have regular menstrual cycles, or fertility medicines if you're having trouble getting pregnant. Having PCOS may make the following more likely: type 2 diabetes, high blood pressure, metabolic syndrome, infertility, sleep apnea, depression, anxiety, cancer of the uterine lining, or gestational diabetes.